Hello, everybody, and welcome to our Speaking from the Heart event. My name's Peter Espenshade. I am the president of the Vermont Association for Mental Health and Addiction Recovery, and I'm really delighted to be emceeing a group of real Vermont leaders in our political community, leaders in our mental health community, in our recovery communities. We have a really exciting program for you tonight. One of the basic principles of our work is listening, is being present for others, for Vermonters who are frequently ignored or underrepresented, and being there for them. And tonight we're going to do some really powerful listening of some very powerful ideas and commitments that our state's leadership has for what we believe in. We believe in a strong mental health system that's going to serve all Vermonters, that is equal to our physical health systems, if not superior to them. We need it so desperately in these times. And the expansion of our recovery work in Vermont, our work in recovery from substance use disorder and other disorders is just at a really critical point right now, I think. So we are grateful that you're all here and appreciate it. Tonight, we are going to hear from a number of folks, as I've mentioned. We are together for the next 2 hours until approximately 9 o'clock, probably a little bit before 9. And we hope that if you're watching this after the event on our YouTube channel or our Facebook channel, that you share this with friends. And if you are here with us tonight, we are so, so grateful to have you. One final note before we start hearing from some of our guests. You know, we were talking the other day about the impact of COVID on mental health and addiction recovery. And I think it's really important for all of us to understand and appreciate that COVID doesn't impact these issues as though they were secondary symptoms of COVID. They are directly intersected with COVID. And I think we not only see that in the news all the time, but can really feel that in our own hearts, in our families, in our communities, that this has had a profound impact on our state's mental health. And we are sadly seeing an uptick in overdoses and overdose death and in relapse. The good news is, as you're going to hear, we've got a network and a group of very talented, committed people who are going to take on this challenge and make a real difference. So thank you. Thank you to all of our panelists for being here tonight. And thank you to all of our viewers. We really appreciate your time. The first speaker I want to introduce is my friend and colleague, Daniel Franklin. Daniel is with one of our recovery centers. He'll be talking to you about that, and is also the chair of the Vermont Association of Recovery Center Directors. Daniel's work in Lamoille County is just full of help and care and joy, and it's expanding throughout his region. We are lucky to have Daniel on our team. And good evening, Daniel. Welcome to you.
Thank you, Peter. Good evening, everyone. On behalf of Vermont's 12 recovery centers, thank you for the opportunity to share about the power of what we do. Substance use disorders directly affect tens of thousands of Vermonters, tens of thousands of families, but in the end, we're all affected. Substance use is linked as both cause and effect to virtually every other issue that we care about, every aspiration that we have as a state, and everything we're trying to do to improve the places we call home. It's my belief that if we're truly to protect the most vulnerable, if we intend to make Vermont more affordable and prosperous, and if we are to recover together from our challenges through actions rather than rhetoric, then helping people achieve long-term sustainable recovery and healthier, happier lives is a linchpin issue at every level of our society. As dire as the challenges we face often feel, if you want to find hope, if you want to find cost-effective, evidence-based solutions to address what is holding our people and our communities back, you don't have to look very hard. Recovery centers are home to numerous programs and services that seek to help people at any stage in their lives and in their recovery journeys. With support groups and recovery coaching, the recovery coaches in the emergency department program and the Moms in Recovery support program, with health and wellness programs and arts and music therapies, with services in prisons and on the streets, and above all through human connection, recovery centers stand at the nexus of prevention, treatment, recovery, and intervention. Because of recovery centers, the innumerable ways in which recovery can be experienced and can be successful are not limited by how many days of care insurance companies will pay for or what types of treatments they're willing to pay for. We are not limited by waiting lists or prerequisites. There are no eligibility requirements to walk through our doors, and no one may be coerced into utilizing what we have to offer. We serve everyone and anyone regardless of their background. And quite simply, we do what it takes to help save and improve lives every day of the year and around the clock. Perhaps most remarkable of all programs and services at recovery centers are provided free of charge. But the most important argument for the value and effectiveness of recovery centers isn't merely an economic one. I'm here to tell you that there are no relationships, no bridges to authentic connection, no catalyst for trust and understanding, no acts of acceptance and non-judgment so strong and enduring as what exists when a peer works with a peer, as when a person who has lived through addiction, mental illness, poverty, domestic or sexual violence, incarceration, or some other aspect of the human condition connects with another and says implicitly or explicitly, I'm with you, I understand, I'm going to help you get through this and I will not give up on you. There are no forms of hope more powerful than the example of someone who has been there and lived to help show the way for another. When I think of recovery centers and other recovery organizations in Vermont, I think about the fact that the staff, recovery coaches, volunteers, group facilitators, sponsors, and other helpers who make what we do possible are the living, breathing embodiment of the promise of recovery and the potential that resides within every person. Every person who survives and thrives in their recovery and chooses to give back is all the proof we need that every life matters and that every life is worth saving. The loss of even one life is a loss for us all. Every person who has achieved recovery is a bright light in the darkest of places. They are the proof that recovery is possible, that a life lived in recovery can be beautiful, healthy, happy, and a fulfilling one. By choosing to work in this field or to help others in whatever way they can, every one of us helps to provide the understanding, the compassion, the healing, and a way forward and through the darkness that we all seek, no matter who we are or what we've endured. All of us are healing from something, and all of us need hope in our lives. That is what recovery centers are about. Not only do recovery centers serve the most people of any node in the addiction-related continuum of care in the state of Vermont, but we do it with remarkable effectiveness and without significant resources in a way that only peers can or would. It is because of our organizational DNA, peer-run, cost-free, and holistic, that we have become a beacon of hope, one that I hope will light the torches of others. Where there's life, there is hope. And where there is life and hope, there can be recovery. Thank you.
Thank you, Danielle. We are so lucky to have you in our state, and so lucky to have your service, the service of your staff and volunteers, as well as all of our recovery centers. There are, as Daniel said, 12 recovery centers throughout the state. There's one in your neck of the woods, and they've been a godsend, in my opinion. We're lucky to have you. Thank you. It's now my pleasure to introduce my colleague, Peter Mallary. Peter has been just a tremendous mentor and help to me in advocating for recovery and in talking about recovery. And he has done so for hundreds and hundreds of other Vermonters, getting folks out there sharing the power and the joy and the possibility of recovery. So Peter, over to you.
Thank you, Peter. I want to also just comment quickly on Daniel's statements. The recovery center system in Vermont is a national model, and a lot of other states are looking to us for leadership. And thanks to the leadership of people like Daniel, we're succeeding in showing that leadership. So thank you, Daniel. I'm going to have the pleasure of talking with a few folks tonight, some people in government, some candidates, but I'm going to start first with my friend and a mentor of mine. It's Mary Moulton. Mary, have you hit the video button? There you are.
Got it.
I'm still not seeing you, but that's, as long as you're there, I'm fine.
I've
Mary,
undone my video piece, but I cannot start the video. There we go. I think it was just a matter of timing.
there you are.
There we go. So good
Mary
to see
is,
everybody.
as I say, a mentor of mine in the world of mental health. She is the director of Washington County Mental Health Services. Did I get that exactly right?
That's correct.
Okay. And as I recall, Mary, you started at Washington County as what?
I started Washington County as a screener, an emergency services worker, back a long time ago now. Yes, very long time ago. It's been 30 years at Washington County Mental Health.
Yeah, thank you. I wanted to get you to speak sort of globally and help us set the stage. And one of the ways I want to do that is to talk about the work of recovery, substance use disorder, treatment, and the mental health system. And if you could sort of outline that a little bit, but also tell me and us what you think, how that relationship, those relationships are working, and how in fact they might work better if you have immediate thoughts about that. But
I think, what I'd say about that, Peter, such a good question. And I reflect back on those 30 years, actually. And starting out as an emergency services screener, we did not deal with substance use disorders and issues at Washington County Mental Health. It was, deal with that someplace else. And I think the most wonderful part of this journey is that we recognize that one affects the other, and that we need to work more closely together. So we're doing that better within our regions. I think in regions, it's different from one place to the other. And it's extremely important that we bring the two together, in my mind, that we work for the whole person. And when they come through our doors, we just address the problems at hand and work to get help through all collaborators. So recovery centers are extremely important in our region in Washington County. And I reach out to Turning Point, reach out to Center for Vermont Substance Abuse Services. We're doing more and more at Washington County on co-occurring services and groups for children, for adults. It's an incredibly important intersect, and it needs to come from the state down. in my mind, as an integrated service. I don't think
Mhm.
we're quite there yet.
Okay. Any thoughts right off the top of your head about what would get us there? What can we do better, Mary? No one.
Well, it's sometimes a shame to say, but practice follows the way that money travels. And
Yeah.
so I think one thing that we could do is make sure that our dollars to support the issues that so many of our Vermonters experience, myself included, in the area of lived experience with my own mental health issues. These things should be addressed from the state down, and dollars should come together. And there aren't, frankly, enough conversations between the Department of Mental Health, for example, in my mind, and ADAP to have that happen. And there has to be the drive for those dollars to be available, enough of them so that we have access for all Vermonters when they need it. And I'll tell you that in this past month, when we've responded to our emergency room with clinicians following up on substance use issues, we've got a doubling of what we had the month before. And so it's concerning me that the COVID overlay, as we call it, is absolutely increasing the needs of our Vermonters, and we need to have the access. So hopefully something our candidates will speak to later this evening.
Yeah. Let's talk about the winter and pandemic. It's a bad combination for everybody. But what do you expect we're going to see? And how, I mean, you talk very frankly about and candidly about resources. And we're going to
Yes.
see the need for resources pretty quick, it seems to me, on that front.
Yes, I think we will, and we have. And so our experience, the pandemic has taken the track of most disasters. And when a disaster hits, there's a lull and a quiet. And that's what happened when actually COVID hit in March. People did what they were supposed to. They stayed within their homes. We knew that the mental health issues would go up, that substance use issues would go up. So just in looking at statistics by May, we were hearing that 45% of the adult population said that the pandemic affected their mental health, and 19% said that impact was severe. Just in the area of prescriptions, that physicians actually increased. We looked at Express Scripts, which is the software that tracks all scripts. And interesting perhaps for folks to know that from February to March, there was an increase of 34% in scripts being written for anti-anxiety meds, 19% for antidepressants, and 15% for anti-insomnia medications. And then alcohol sales went up 55%. So, as we look at that period of time, people were staying in and they were doing what they were supposed to. Then we began to see more impact. We did a lot of telehealth that worked for a tremendous amount of people, but for some people, it was extremely difficult, particularly for people who experience psychosis. And so we're beginning to see that increase back into our emergency rooms now, that people could come out. I think folks are really tired. I think we're looking ahead at the winter, and we're knowing that it's going to be extremely stressful. And some of these statistics that I've been talking about, we'll hear about again, right? We'll hear, if there's even more of an increase. But we are absolutely seeing stress in people. We're seeing stress in ourselves. This affects all of us. That's what I think, we all can feel this evening is, the stress I see in my staff when they're trying to keep up, the stress that we have because we love to gather, and we should do as much as we can of that. We should watch a little bit around limiting our TV because it's difficult to watch the COVID experience all the time, know the facts, but take care of yourself. Go out where you can. We've got to, as winter comes along, really be attentive to self-care and being there for each other in a kind way.
Thank you, Mary. I think that's very good advice. What about the treatment system? I just want to talk about hub and spoke for a minute, and I'm mindful of time because I want you to feel, because you offer so much about the mental health system, that you just pop back in some of these conversations. I may call on you, or if you feel there's something you need to add, just press share video, okay?
Okay, will do.
But the hub and spoke system, if you could just touch on it for a minute for anyone who doesn't know about it, and then explain how you think it's functioning. I know that in terms of funding, there are issues there too, but if you could speak to hub and spoke for just a minute or two, that would be great.
I certainly think it's been, it was an innovation a while back, right? Barbara Samaglio worked hard on this with so many people and has actually created a system for people to get treatment. And we work really hard with Hub and Spoke in Central Vermont, and I think this is in other places as well, to have rapid treatment from the emergency room to the hub so that we could do an assessment in the emergency room and get people immediate access over at the hub where they can they can sign up for medication assisted treatment, and they can also have some counseling at the same time. So a robust system. It was difficult during COVID. I could tell you there was some real scrambling as to how we would do that when everything shut down, transportation, how do we get the medication out to people? I think we learned a lot about that during COVID so that we'd be more ready should we have another shutdown, for example, this winter. The difficulty is in maintaining workforce on the counseling side of that fence. And having, again, the resource available. So when people walk in the door, they're not on a wait list. It's really,
right.
We've been able to shave that down, worked really hard on that over time through different methods of getting folks in, and, interested in hearing from other folks this evening how that might be working. But in our area, and from what I am hearing from other areas, working quite well, but with workforce issues and being able to keep people with us in that endeavor, similar to the mental health system, not paid the same. So as say hospitals or educators or state employees, we have to recognize that this is healthcare, that people need this assistance, and whether we're talking mental health or substance use treatments of this order, it is healthcare. And we should be looking at it with the same vision and the same approach.
Thank you, Mary.
I'm sorry, there's that opinion that came in.
Mary, one of my favorite things about you is that you have opinions, and they're always worth hearing. Okay, Peter, I see your, Mary, thank you. I will be calling on you later, and Peter wants to move us along. Is that right, Peter?
Yeah, but Mary, thank you. You're always so passionate and articulate, and it's so important to bring up the workforce issue. We've got some incredibly beautiful people doing mission critical work in healthcare for really modest salaries. And we owe you and all of your staff such a debt of thanks and a commitment to working on that. We're lucky to have you.
Well, thank you, Peter. Thank you for this opportunity. I look forward to listening.
Great. All right, shortly, we are going to hear Peter Mallary talk to Lieutenant Governor Zuckerman, and we're really looking forward to that and grateful to Lieutenant Governor for being here with us. Before we get there, we do have a message from Governor Phil Scott, who is unable to join us tonight, that I'd like to read out loud. So this is from Governor Phil Scott. It says, "Good evening. I'm very sorry I could not be with you tonight. I appreciate Peter's offer to share some of my thoughts on where Vermont is in addressing substance misuse and supporting recovery, as well as how we're doing in meeting Vermonters' mental health needs. I think it's appropriate to ask these two questions together. Substance misuse and opioid misuse are often a symptom of an underlying mental health condition. As we continue to address the opioid crisis, it's important to not be too narrow in our approach, nor think of substance misuse and recovery as a singular health challenge and overlook what can sometimes be the root cause. I'm proud of some of the progress we have made in addressing substance misuse and opioid misuse in particular. On my first day in office, I created the Opioid Coordination Council, which was set up to look across state government and our partners to break down any silos in our response to this crisis. Their work directly impacted policy. We have put unemployment counselors who work for the Department of Labor in Vermont's recovery centers to help those in recovery find and keep jobs. The OCC elevated the importance of recovery and helped Vermont make progress in the area. The OCC further impressed upon us the importance of having treatment available when someone needs it. Accordingly, we've expanded our treatment capacity, adding the hub in St. Albans and greatly reducing wait lists for those who are ready to start their recovery process. The OCC helped us change attitudes towards addiction as well, recognizing it as the disease it is, which has changed how we treat those suffering when they come in contact with state government, the courts, or our public safety system. Through a pilot program, we have embedded mental health professionals in some of our Vermont State Police barracks, who provided different perspective in challenging situations. At my request, the legislature just expanded this program to cover nearly all barracks. We have made investments into Vermont's Guardian Ad Litem program and launched a child protection initiative through the courts, which supports parent-child contact and reduces court backlogs for families impacted by the opioid epidemic. These are some of the highlights. We've made similar gains in supporting Vermonters' mental health needs. The common theme, I believe, is in treating substance misuse and mental health the same way we treat physical health. In our health care reform efforts, we have secured a federal waiver which allows Medicaid to pay for inpatient residential treatment for substance misuse. However, there is so much more to do, especially given the pandemic's adverse impact in these areas. It is clear the pandemic has had an outsized impact on vulnerable populations. We are seeing alarming trends in our data related to substance and opioid misuse. And anecdotally, we know many Vermonters are struggling with the upending impact this pandemic has had on our daily lives. To come out of this stronger, we need to address these secondary impacts of this virus. I am committed to this mission, building on the important work we've done, and look forward to working with many of you as we move forward. Thank you. Signed, Governor Phil Scott. Peter Mallary, back to you for a talk with Lieutenant Governor Zuckerman.
Thank you, Peter. And I'll thank the governor for sending that along. I had chats with him and he just couldn't schedule it for today, but I'm glad he took the time to do that. David Zuckerman, Lieutenant Governor, are you there?
I'm right here with you, I believe.
There you are. Good. I thought we made a decision not to make this a debate format. On the other hand, the governor's just made a statement, and it is my recollection that you may be running against the governor at the moment. So I wondered if you had any immediate response to his statement.
Well, I don't know that it has to necessarily be sort of a debatey thought in that way, but I do appreciate the opportunity. And thank you everyone who's watching and listening. You know, I think it's important when any of us are seeking the position of governor, whether it's an incumbent governor or someone like myself as lieutenant governor seeking that position, that folks do take the time to visit with folks to talk about why they've done what they've done and what our hopes and views are for the future. I do happen to think it's a lot easier to have a prepared statement that staff and yourself help write than it is to just be present and answer conversations and have such discussions. And so I welcome the opportunity to be here to have a conversation with you, Peter, and you know, all of the folks here around these issues. You know, I think it's really been devastating. COVID has really exacerbated many areas that are being talked about tonight. We have seen from January to June, year over year, a 50% increase in substance abuse disorder overdoses, from 48 a year ago to 72 this year. And that's just devastating. And that's not included in the official COVID count of deaths of around 50 in this state. But if you include those, it's really a tremendous impact that COVID has had in terms of people's access to services, people's increase in struggles in various ways, you know, from access to treatment, MAT and others, to just simply the stresses and strains of the COVID crisis on people's economic well-being. You know, we have 60,000 minimum wage workers. At one point, we had 70,000 people on unemployment and applying for unemployment this spring. And I think there's a real challenge going forward where there isn't the vision that's taking on the scale of the consequences of the COVID impact on our economy and on people's well-being. You know, the stresses that Mary was talking about are very real. I can tell you in my own small business on our farm, we have seen huge stress in trying to shift the operation of the farm to be COVID safe for our employees, COVID safe for our customers and our farm CSA and at the farmers market. It has impacted our employees, impacted our own lives and my family in terms of the day-to-day stress of COVID. And we know that there are going to be added needs in those services that Mary was talking about earlier. And I don't think the scale of response meets by the state really meets what's going to happen this winter. We know, I was talking to Sue Minter a couple of weeks ago, and she said the number of applicants for heating assistance this year compared to last year at this point, there were 1,000 applicants a year ago. There are 3,000 applicants this year. You know, when people are living under economic duress, that is going to really exacerbate mental health struggles that people are having. People are financially unable to put food on their kids' table or keep the home heated or feel like when the emergency orders end, they're going to get eviction notices by either their landlords or their banks foreclosing them. That leads to many of these mental health struggles that people go through. And I don't think the state is really prepared by the administration's perspective well enough for what's going to come this winter. And I'm terribly concerned. And it's one of the reasons I'm involved in this race is I just feel like we don't often see the activity be taken not only in dealing with the COVID crisis from a health perspective in the moment, but the vision of what's coming, both in terms of the challenges we need to tackle as well as the opportunities to really build us a new economy out of this, to get people back to work, to get people fair wages. Even raising the minimum wage, to me, is related to mental health and is related to economic struggle and duress. And there's a big difference between me and the governor in that regard. I think Mary was talking about the wages that people make in these fields. And it is really not high enough to live on. So people who are helping other people with mental health are living under financial stress that is going to create mental health struggles for themselves as well. So there's a number of issues there. But Peter, I know you'd also like to maybe go back and forth on a few of these topics. So I'm happy to go into that conversation.
Well, I was struck that the governor talked about the OCC a lot, the Opioid Coordination Council, which I was on. And we had a four-legged stool there. It was prevention, treatment, recovery, and enforcement. And I'm not asking you to immediately tell me what your priority there is. I just wondered what your response was to those four categories as a way of approaching the issues of addiction, et cetera.
Well, sure. I mean, I think for me, I'm going to start on enforcement and really kind of break that down a little bit. When people have substance use disorders, no matter what they are, that is a health problem. It is, to me, barely an enforcement problem. The issue of supply and demand, and I guess enforcement is around dealing with the supply side. As long as there's demand, there will be supply. We will never arrest enough people and put enough people in jail to eliminate the supply of something for which there is a physical craving that creates a demand that will not go away without the treatment that's necessary. And the treatment is necessary because there hasn't been enough help in prevention and really stopping it before it starts. And we know that a huge amount of that certainly came from the medical use of prescription opioids. On the other hand, we also know that folks get into these struggles not only through the pharmaceutical direction, but also the experimental side. And so prevention means really investing and using dollars to make sure there are other opportunities for people to find entertainment, to get involved, to get gainful employment. The investment necessary, whether it's in our state colleges, whether it's in technical schools and training, to give people opportunities to be fulfilled in their life to where they don't go down a path that leads them to an abuse disorder, substance abuse disorder. So, one of the, I guess, my lens on a lot of these different substances, and folks here I don't think are surprised to know my history with trying to change our cannabis laws, that I know some in the community are concerned about and others are more positive about. The use of various substances is going to occur. The question is, how do we make sure folks know that if use of substances is becoming a challenge, that they will be welcomed with support and help to become on the road to recovery and stay on the road of recovery? How do we have these substances in our society? I really don't think we will eliminate them. We have tried to eradicate substances from prohibition of alcohol to prohibition of just about everything else, and we've never succeeded. The only thing it succeeds in doing is making stronger, more concentrated substances that then often lead to greater challenges for people. And so to me, it's moving towards a direction of making sure we have all the supports in place for those folks for whom it becomes a challenge and a struggle and their body becomes chemically, unable to break from these substances, that we have every single support possible there. And the best way to do that, of course, is to prevent people from going down the paths in the first place, which means education and opportunity.
Great. Okay. The hub and spoke system, Mary and I talked about that a little bit. And it's arguably the cornerstone of Vermont's opioid use disorder treatment strategy. And most medical services and we could talk about how this is done, have seen hikes in support, but of some sort or another. And the hub and spoke system hasn't seen any raises in support since 17, I believe. Thoughts about that? One, about hub and spoke in general. Is it working in your opinion? And what do we do about supporting it if it is?
Well, I'll certainly reveal I'm not an expert, but my understanding from most people I hear from is that it has been relatively successful. I think it's always important, no matter how successful something is, to always keep an eye on it, evaluate it, and see if there are ways to expand or make it work better. But in general, I've heard generally good things. The challenge is resources. And I think this is where you said it's not a debate, but the governor could have been here and made his points, but he chose not to be here. I would argue that when we are creating budgets and we are saying we're caring for our most vulnerable, and yet we're not funding the resources necessary for a program to expand like Hub and Spoke in order to take care of those who are vulnerable, then we're actually not passing budgets. We're not putting the resources in that need to be there to care for our most vulnerable. Sometimes the language and the rhetoric sounds really wholesome and complete, but we know if people are falling through the cracks, if people are dying from substance use disorder, people are really struggling, then, thank you, Jessica, I'll take a look at that note, then you really, we are not funding this to the level we need. I also believe that we need a couple other adjustments to our system in the bigger picture. We need universal primary care, which would certainly be an opportunity for folks to access health services as a family, as children, as adults, as young adults, as was just made as a comment regarding where some of these substance abuse disorders start, which is in young teenagers, that the sooner we have folks in regular primary care, the sooner we have access to these conversations with them and with their families. I happen to think it would help our economic system. It would help our businesses, which would all then put families in better economic situations, which also is an issue. Excuse me, a cat just joined me in my lap here. I hope it's not too distracting. So to me, caring for our most vulnerable is not just words. It's really about making sure we have the resources in state government in order to make sure programs like the hub and spoke system and others have the resources they need.
Hey, Mary, hit share video.
Got it.
Mary,
Yes,
how are you again?
good.
I just wondered if you had something you'd like to ask David.
I just wondered, David, how you would change or support those increases. Same on the mental health side, where we don't have regular increases and have moved to value-based payments and haven't seen an increase in a bundle in 3 years. And AHS does not put forth a budget that increases those rates, unlike hospitals with the Green Mountain Care Board and increases in rates. What would you see? What would your vision? How would you change that? Knowing that, in fact, those people we serve in these systems might be a high percentage of Medicaid and state dollars.
Well, I think this is where the conversation goes in terms of how do you create a budget? Do we first analyze what the needs are and recognize those complete needs and what those costs would be, and then look at how do we get the resources in our state, both from federal government and those supports, as you were just talking about, but also from our tax system and how the taxes are allocated across the state. We have always done it by a taxes first, and then say we have this much money to address all the issues in state government. And then we say, well, we don't have enough, so we're not going to raise resources here. We're not going to raise resources there or spending in those areas. We're just going to say we're meeting the needs as words, even when we're not meeting the needs in reality. And I think that's part of the political smokescreen that we've seen for the last 4 years. And frankly, I'm tired of it. I know a lot of Vermonters are tired of it. And when you look at the struggles people are in right now, and the fact that Wall Street is doing generally just fine, people with large investments, they are not struggling through COVID right now. And yet tens of thousands of Vermont families are struggling tremendously. And these resources are there. There are Vermonters who annually make more than $250,000 a year. And I would have thought through the COVID crisis, people would be reevaluating what is most important in life. And is it to have that much money, or is it to make sure our neighbors and our fellow citizens of Vermont are cared for through this struggle, and that we can make the investments not only in these kinds of supports, whether it's mental health or substance use disorder or a hub and spoke system and so forth, but also investments in economic development, in weatherizing working class people's homes so that your monthly bills are lower as we go into the winter. And therefore you have more resources to put food on the table or academic opportunities. And we also, frankly, have to look at our huge human services budget, our huge education budget, and look for ways to make the system more efficient. Not just by drawing a line on the piece of paper and saying, we're going to save 2%, go in and cut 2% from every program, but instead go as government leadership, roll up our sleeves and meet with frontline employees in human services, meet with frontline employees in education and say, where are we duplicating services because we do operate in silos? I appreciate the governor talking about breaking down the silos through his opioid council, but where's looking at these silos all across human services, where I met a woman the other day who had to do 9 different applications for different programs in the Agency of Human Services, whether it was child care supports, food service, heating assistance, housing assistance, and so forth. We are still operating in a siloed mindset from 20, 30, 40 years ago. And it really seems to me like we could develop much better wraparound services, even within maybe the schools as human service hubs, as community centers, because in some respects, with 12 human services offices around the state, there are certain families that can't access them. They're 30 miles away, 40 miles away. And if you have one vehicle in a 2-parent household working 2 different shift jobs, when is someone supposed to be home with the vehicle and the family to go access services? Whereas if you had at least a touch point in every town based in our schools or a town center somewhere, at least to open the door to the process, we could get much earlier intervention, prevention, and support for families, which I think would be a much more efficient program, which would free up resources for expanding some of these other arenas. So it's not only just taxing more and spending more, it's also making government work better, again, not by just drawing a line on a piece of paper, but by actually doing the work. And that's sort of one of the things I feel like I bring as a farmer. When you have a problem, you don't always have more money you can throw at it, but you look around what you do every day and you go, okay, how can I do this more efficiently? And you really work at it. You don't just say, somehow it's going to get better.
Okay.
Thank you.
Yeah.
Well, thank you, David. It's been wonderful that you could take the time, and I know you've got something else coming up soon. So, but I'm awfully glad you were able to be here with us. And good luck out there. It's good luck to everybody. But it's
Sure.
hard work you're doing. I've done it, and so hang in there.
Well, I appreciate that. I do want to let folks know that whatever happens in the election, I'm lieutenant governor until January. So if people have services or needs or need access to my office, you can always reach out at ltgov.vermont.gov in order to utilize my office for possible access points or ways to find help if you need help. As well as, of course, you did mention I'm running for governor. So if you want to reach out to me on that side, they can reach out to me at Zuckerman, FORVT.com. That's Zuckerman for Vermont.com. So depending on your need, use the appropriate avenue to reach me and my teams. And we'll do what we can to help folks, because I know, again, many, many people are struggling right now and often don't know where to turn. I've got someone messaging me right now throughout the last 3 or 4 days, really struggling in central Vermont, So Mary, I'm probably going to reach out to you tomorrow with respect to how do we find help for this individual with the struggles they're facing. And that's what we all do as neighbors in Vermont. And I really do appreciate what everybody here does for each other, as well as, the help that we all know we can give when someone needs it. So thank you for the opportunity.
Great.
Thanks,
Thank
David,
you,
very
Lieutenant
much.
Governor. Really appreciate your time. Grateful to you.
You bet.
Great. And thank you, Peter Mallary, for leading that conversation with the Lieutenant Governor. Next up is a woman who, when I think of her, I really think about what we were just talking about. I think about innovation and breaking down silos and creating new connections. Tracie Hauck from the Turning Point Center, our recovery center in Rutland, has just done an amazing job in forming real connections with all aspects of society in Rutland, from commerce to local government to police departments. She's been incredibly innovative in the way she has run her center. She has hired some superb staff members, and she's created this really kind of best practice connection between recovery centers and correctional facilities. When one leaves a correctional facility and you are interested in pursuing or continuing your recovery, in the Rutland area, Tracie and her staff are there for you, and there for you even when you are still a resident at the correctional facility, creating this really beautiful handoff. And I just think it's yet another innovative program at one of our innovative recovery centers. Tracie's also a terrific person. And Tracie, why don't we turn it over to you? It's good to see you.
Well, thank you, Peter. It's good to see you and everybody that's on here. I thank you for the glowing introduction. What I'd like to talk about is, when I started with the recovery center, it was the first day of my recovery, basically. I ended up going to the Turning Point Center to attend a 12-step meeting. I'm a person in long-term recovery, and that's been since May 15th, 2013. I was a registered nurse for almost 30 years, well respected, and I got addicted to opiates, and I forged prescriptions, and I lost my nursing license, and I really felt alone. And the one thing that I got from going to that center was I felt accepted. I felt that it was okay for me to be there, and nobody needed to ask me a bunch of questions, and I could just kind of learn and observe and meet other people. And over those years while we were there, I realized that it took me a while to really understand where people come from with substance use disorder. Many of the people we served did not have the privileges that I had. They grew up in families that had generational substance use, their trauma, PTSD, childhood abuse, no role models in the family. And so, we had started a program with a previous grant that we had where we were doing some groups in Marble Valley Correctional Facility. And when that grant kind of fell through and didn't continue, we decided to continue that on our own at the center. And this was back in 2016. So it was myself working part-time and another recovery coach that I had, 2 women that went into the male facility, and we did groups. We did a smart recovery and we did a making recovery easier group. And it was amazing because as I got to know the individuals in there, I realized it really didn't matter to us what they had done to get themselves there. They were all hurting individuals that came from broken backgrounds, that the only way that they felt like they could they didn't have any self-worth. They didn't have any sense of value. And they felt like everybody looked at them as felons or addicts. And, to be able to listen to stories that they share and talk to them about the background behind their substance use disorder, it just opened my eyes that these are people. They're people like me, like you, like everybody else, and they're struggling and they don't know where to go and they're feeling like they're judged. So we continued that program. And then in 2018, we ended up getting a grant to actually do those groups in the jail and offer recovery coaching one-to-one in the correctional facility. And we also worked with probation and parole. We worked with DOC transitional housing. We worked with state drug court. We've been working a little bit with federal drug court, and we continued that program. And, the gratitude that we got, and, the idea was that we wanted to provide that connection to the individuals that we served that were sitting in the jail, so that when they got out, that they would feel comfortable to come down and see us at the center and get involved and continue recovery coaching. And we were amazed at the responses, the letters that we would get to the center from the inmates. They need connection. They need people that they can talk to, that they can ask questions of, and they don't understand a lot of the options that are out there for them when they're sitting in jail. They don't understand, what is it going to look like to say, go to a DOC transitional housing? What's it going to be like in drug court? What's it like, to do this or that? How do I access this? And our recovery coaches can help provide that. And when you've established that trust with them beforehand, they will come afterwards when they get out. We followed about 100 individuals, and we had 67 of them that had, and this was by February of this year, 67% of the people that we followed had not committed new crimes and had not been reincarcerated. And we multiplied that number, 67 out of the 100, by the average cost of incarceration, which was about $67,000, and it saved the state over $4 million, which is amazing. And it's just so simple. It's providing that connection. It's providing support. It's just really, truly meeting people where they're at. And, we plan on continuing that. We had a 3-year grant. We'll continue that program. And we're trying to do more. We're trying to do outreach. We're applying for another grant to do outreach to the rural communities where people don't have transportation, can't get into Rutland. And hopefully we get funding for that so we can go out and truly, truly meet people where they're at. And I'm hoping that, more people, like we support family members also. We've had family members come in and get coaching. We've had people that, write us that, they don't know where to turn. They don't know what to do. We want to break down the stigma. We want to be able to have people openly kind of talk about what they struggle with, whether it's family members with somebody with substance use disorder or people that, are going through substance use disorder. And many of the things, that we talk about, ideally it would be great to get people to be 100% abstinent when they first decide they get into recovery. But the reality that I see is that there's so much pain, there's so much trauma, there's lack of supports, there's lack of sober housing. We have hardly any sober housing in Rutland County. So people are, they may get out of jail, they may end up going and living with somebody that is still using. All those factors, make it very difficult for anybody to stay clean. So if they're doing a harm reduction model, we're going to support them and walk with them all the way. It's, progress, not perfection.
Wow, terrific, Tracie. Thank you so much. And thank you for those programs. And thank you for talking about connection. One of the things that we often talk about in recovery is the opposite of addiction is connection. And with COVID and just with modern society, we're not seeing that. And it's really nice seeing your programs rooted in those connections. And
Thank you.
anytime we can save the state $4 million in one pilot program, it's pretty terrific. So
Doesn't mean they're doing perfect, but you know, they're becoming productive members of society slowly, you know?
it's great stuff. Thank you. Thank you, Tracie.
you
Thanks
very
for
much.
joining us. And thank you for your work. So Tracie was talking about connections, and she was also talking about how, you know, recovery is not just abstinence. I'm a person in long-term recovery myself. And I think, you know, many of us in recovery realize it's not just about abstaining from use of the substance, but it's about reconnecting your life with love and purpose, the way Gary DeCarolis always puts it so beautifully. And so that can mean a job, it can mean a relationship, it can mean reconnecting with your family. It could mean a place to stay with people who are in the same space where you are, headwise, and it could be a really wonderful match for you. We're seeing a nice growth in recovery residences in Vermont. And I want to bring our colleague Sheila on board. Sheila is the director of the Second Wind Foundation's programs, the Turning Point Center in the Upper Valley, and a number of other programs, including Willow Grove, which is a recovery residence for women. And Sheila, we'd love to hear your thoughts and your take and your observations on recovery residences in your area and why they're so important.
Thank you, Peter, and thank you everyone who's here tonight. I have to tell you, one of the reasons that recovery residences are so important is I just have the word on my telephone that at Willow Grove, the women and my two staff there and a lovely student that we have are all there carving pumpkins and listening in. And really wonderful, wonderful things happen in our recovery home at Willow Grove. Women come there and they're able to have a safe place. I think the first thing that's really important is simply safety. They get support. They're with other people who are doing the same thing. We provide case management, and women are able to set their priorities and find work, or they may be moving towards reunification, or there are all kinds of things, legal issues that women are working on, and we're there to help them every step of the way. I really want to talk about, we say we support women in recovery, and we have had children who have lived at Willow Grove, which is always very, very special. Everyone in the house becomes a mom, and it's a beautiful, beautiful thing. But one of the things I've been thinking about is parents and children. And I've worked for the Second Wind Foundation for 14 years, I think. And I recall at one point a group of women coming in that were in their early 20s. And each mom that dropped them off, there was this instance where they were looking at me and I think looking for some reassurance, which I attempted to give to them the best that I could. But the truth was at the end of the day, they didn't have any power and their child had to make their own choice. But how intense that was when that interaction that I had with people, and how sacred the parent-child relationship is. And also the parent-child relationship in terms of For instance, our Willow Grove director, Sarah Mikos, is a graduate and is now the director of Willow Grove. And her 3-year-old, I think he was, lived at Willow Grove. And what's funny is another woman had a child there at the time. And those 2 children, I think 7, 8 years later, are still best friends. They call each other on the phone. So there's community and friendship building and just wonderful things that happen. I want to say that we are a certified residence with VTAR, hard work by Sarah Mikos to make that happen, the Vermont Alliance for Recovery Residences. And it's clear that we need more support beyond treatment, that when you leave treatment, that you have to have a solid place to build your foundation. And I want to tell you why I believe this is that in 4 days ago, maybe 5, a Facebook page was created, a private page for former residents of Willow Grove. And we sent invites to all the people that we knew. And we have, 5 days later, 54 members, women who were at Willow Grove, who are still out there, still connected, still in recovery, and so excited about getting together and helping each other. So that speaks volumes, and I'm so excited. I've been talking to people that I haven't seen in a long time and listening to really beautiful stories of success. And I think that that's what David was talking about, is to develop a life that really is worth keeping safe and worth staying in recovery for. So that's all that I have to share. And I thank you for allowing me to be here.
Oh, we're so lucky to have you. Thank you, Sheila, and thank you for sharing those stories. And on an important note, let's give a big shout out to the women of Willow Grove.
Woo!
So glad you're here. There's just a lot of joy that comes out of that place whenever we get one of those women at a training or an event. So terrific work. So we're at roughly the halfway mark. I want to just sort of place us where we are. We are now going to watch a very brief video on recovery services and the recovery centers in Vermont. It's only about 3 minutes long, I think. Might be a chance for you to watch it or to run and grab a snack. Then when we come back, we will have Peter Mallary talking to Molly Gray. Excited about that. We will hear from our friend and colleague, Fawn Montanye. Excited about that. We're going to have a video with Milne and Dawn and Greg Tatro as well. So we're going to turn the video on now. Again, I think it's 2 or 3 minutes, and then we're going to get into some more conversations with these folks. So Danielle, I will turn it over to you if that sounds good.
Awesome. Thanks, Peter.
Thanks, Danielle.
Here's the video.
Hello, I'm Vanessa. We're here in the lovely state of Vermont celebrating recovery. I work down in Brattleboro at the turning point of Windham County, helping people at their most vulnerable when they're in the hospital and suffering from substance use disorder. Our recovery resources are spread throughout the entire state of Vermont, but we remain connected through the power of recovery. Recovery means to me, healing.
Recovery means to us
freedom. Recovery means to me rebirth.
Recovery means to us connection. Recovery means to us
hope. Recovery means to me beauty.
Recovery means to us purpose.
Recovery means to us
A journey.
Recovery means to me being a new creation.
recovery means to us
having fun.
Recovery means to me
life.
Recovery means to me self-expression.
Recovery means to me health. Recovery means
To us.
freedom. Woo! Recovery is fun.
Recovery means to me second chances.
Hi, everybody. My name is J.R. Lane. I'm a recovery coach here in Bellows Falls, Vermont. This is one of the newest satellite offices in the state, and it's a great privilege and honor to be doing this work. I am able to help as a recovery coach people who suffer from substance use disorder attain and maintain long-term sobriety, because recovery is possible. And what we need from you as the community is your buy-in and your empathy and understanding that this is a disease, not only to fund these programs, but also to support your friends and neighbors who may also be afflicted with it. It is something that we can recover from. Recovery means to me hope, happiness, and freedom.
Terrific. Thank you, Danielle, for showing that. I think we may show it again at the end. We have another version of that we're going to show at the end of this event. So, Peter Mallary, over to you
Hi
for
there.
a conversation with Molly.
Just before I bring Molly on, is it absolutely essential to work at VAMHAR if you have to fiddle with your glasses?
Yes, well, at men of a certain age, that's what we do.
Molly, have you pushed the share video button yet?
I am. Peter, I'm
There
here.
you
Good
are.
evening.
How nice to see you.
Nice to see you as
And
well. Thank you so much for having me.
Well, for those of you who don't know, Molly is an assistant attorney general and running for lieutenant governor. And I've known Molly since she was, what, 5?
Knee high to a grasshopper, as they say.
Her parents are old constituents of mine, and I've known Molly a long time. So always nice to see you.
Thank you.
I'm not sure where we want to start. I'm interested. I asked David about the prevention, treatment, recovery, and enforcement quadruped. And I wondered if you just had any thoughts off the top of your head about those 4 approaches and any ideas about it.
Yeah, thank you so much. And I want to acknowledge first that I'm here, and it's been so incredible to listen to Sheila and Mary and Tracie. I look forward, if elected, to having an open door and spending a lot of time listening. I'd love to be able to get around the state and visit different treatment facilities across Vermont. I think the work that you've done to help Vermont be a national leader is incredible. It's just another area where Vermont can lead. I guess I'd like to share just a little bit about what I've heard from the campaign trail over the last several weeks before answering a question, because I think it actually plays into the answer. And that is, in doing 8 community forums across Vermont during the month of September, again and again and again, one of the questions that came from participants in communities is, what about mental health? Molly, Vermonters are struggling. What are you doing to talk about that? Molly, do you know that there's an uptick in substance use disorder right now in the state? What are you doing? And so I guess I'm just really glad that this is happening tonight, and I know it would happen regardless, but I'm not sure we're really talking about how much Vermonters are struggling publicly, and especially as we're preparing for a long winter ahead, when in many ways what we've had over the last several months is a long winter, right, of being isolated, having to be socially distant. And I just want to acknowledge that folks are having a really tough time. And then I'd like to talk a little bit about what I've learned as an assistant attorney general. And again, having this feed into your question about prevention, treatment, recovery, and enforcement. I work in the AG's office. I'm on leave now, but and as a prosecutor. And as folks may know, that means that when cases come to my desk, you're reviewing the history. And time again, we see that it's the state stepping in when the worst possible thing has happened, whether someone should or should not end up going to jail. And the very first sentencing that I had as an attorney, it was with a co-counsel and there to support her. And I was in Barrie, and I remember the opposing counsel sat down at his table with the defendant, and the judge said, before the sentencing, do you have anything you'd like to say to the defendant? And the defendant says, well, yes, and stands up and he says, I'm paraphrasing, but he says, I'd like to thank the state. I'd like to thank the state because I'm going to jail, and that's where I would receive treatment for my substance use disorder. And I have to admit, as a human rights lawyer who has worked across the world and worked for our congressman in Washington, to come home to Vermont and to be working in our AG's office and to find that individuals are going into a prison system because that's the only place that they can receive treatment just doesn't seem like we've put the emphasis in the right place. So I think the focus really needs to be first and foremost on prevention, and that starts with having a really open and honest conversation at a statewide level about substance use disorder, about mental health, starting at the very earliest ages in our schools, addressing root causes, equal access to internet and broadband, to food, to good quality housing, good paying jobs, mental health and support services as part of adequate access to childcare, and especially in our rural communities. Second, I do want to talk about treatment and also recovery. I don't think, just based on what I've heard today, that we've invested enough in ensuring that there's adequate access to treatment. And then specifically what we know is, and I think this was something that Tracie was talking about, and Tracie is doing incredible work in our prison system to ensure that those who are coming out of our prison system have the support they need to continue treatment and to continue recovery. But so often we see a lack of investment there, and then individuals quickly going right back into our prison system. I think we have some of the best community justice centers in the country. I think we're a leader on restorative justice. I think we have incredible COSAs, and we've seen the impact of that. But there's more that we can do. And I think that begins with a recognition that the worst possible thing is for incarceration to happen, and that we need to invest in prevention, treatment, and recovery. And I would put those at the forefront, I guess, before enforcement, although I know they need to work in tandem.
Okay. Let me see, what do I want to ask you next? I have a few things. The president, as you may or may not know, has signed an executive order which prohibits work on addressing racism within organizations receiving federal dollars. And I just wondered if there's not a change at that level and this order stands, what would you think about addressing this on behalf of mental health agencies and other agencies working for reform.
Yeah, I think this is just the latest example of why what happens at the national level can be so harmful to Vermont, and why we have to take steps right here at home, be it on ensuring Vermonters have access to adequate healthcare, treatment and support services, be it including mental health, with or without an Affordable Care Act, right? Because we don't know what's going to happen with that potentially after the election, and
Right.
we're taking up that case. The same is true with women and access to reproductive rights, certainly if Roe v. Wade's overturned. And then with an executive order like this, my goodness, I mean, that's just outrageous. Let's just acknowledge that first and foremost. But what we know here in Vermont is that systemic racism does exist. We see it in our criminal justice system with people of color being disproportionately incarcerated. We see it in access to healthcare, absolutely. Access to mental health and support services, to education, to housing. Even in this pandemic, we knew that basic public safety and health information wasn't translated into the languages of our new Vermonters. And I know I'm getting a little bit off track here, but I think this is just another area where we have to come together as a state and say, we're going to do things differently. And we're going to look at our budget and align our budget with our values and our greatest needs. We're going to invest in prevention. We're going to invest in treatment. We're going to invest in recovery. I would like the Lieutenant Governor's office to be one where we remove the stigma around mental health. We remove the stigma around substance use disorders. We all have our own experiences. We all have family members who have struggled, or friends, or others. And I think it's time as a generation, and I'll just share this personally. I think I grew up at a time where, if it doesn't kill you, it makes you stronger, and you just don't talk about it. Well, those times have passed, and there is a younger generation that is talking, ready to engage, ready to act. And I think we need to continue to work with them to push the envelope and to continue to build on the incredible success of our hub and spoke system, the national leadership that we've shown, and then to really have leaders in statewide office who are committed to doing that, which is it's what I'm committed to doing as Lieutenant Governor.
Mary, let's see if we can get Mary, Molly. Mary, are you there? There you are.
I am
again.
here. I am here. Hi, Molly. Hi.
Just wondered if you wanted to dive in.
Just wanting to ask the question, as we have discussions throughout our communities, and you might have spoken a little bit this weekend, in fact, on, I can't remember the name of the show on WCAX, but a little bit of talk around law enforcement and the discussions we're having currently in our communities, how best to help people, in fact, who are presenting in mental health crisis, who have crises due to substance use. The current move, yes, to put clinicians into Vermont State Police, but there's not enough to put them into our smaller agencies. What is your thought right now on some of the movement around defunding police or shifting some of the responsibility?
Yeah, thank you so much for bringing that up. I don't know if I shared it, but if not, I meant to, because I talk about it a lot. We've seen, and over the last 2 years, more officer-involved shootings than ever before. Law enforcement responding to mental health crisis. And oftentimes there's substance use involved. I think there needs to be a proper discussion about what happens in those moments. How are we ensuring that the proper mental health and support services are available to individuals? As we talk about defunding the police, which I think that's the wrong question. I think the question is, how are we allocating funding? How are we ensuring that mental health, DMH, as you mentioned earlier, and ADAP have a real conversation, that there's a real dialogue to make sure that the support services are there at the ground level. And then working with police right now to ensure that there's proper trust, there's proper training, and that they're responding to what they need to respond to versus where we need to have mental health professionals at the ready and providing a lot of support. So I think it's time to sort of step back, reassess our budget, reassess the mandates that we've given different professionals in our communities, and then figure out a more holistic approach that keeps us safe, but also addresses root cause and is a more compassionate approach.
Okay. Molly, we're close to winding up on this chapter, but I wondered if you had anything you just wanted to add as we do that.
Well, I just wanted to thank you, Peter, for the opportunity, and thank you everyone for giving me a moment to just introduce myself. I'll admit I have a lot to learn, but I'm ready to listen. I'm ready to learn. I'm ready to meet you all where you're at, to get around the state, to have a real open door, to be an ambassador for removing the stigma, for talking openly, talking clearly, making sure that Vermont can continue to show leadership, and that we come together and work together and take care of each other, not only through this troubling time, but as we move forward into a much brighter future for our state. So thank you so much. And I'll leave my information in the chat if anyone would like to follow up, but I hope this is the first conversation of many to come. Thank you.
Thank you. Thank you, Molly. And as I said in an unbiased fashion to David, good luck out there. It's hard work. I know that. So
thank you.
Be well. Peter.
Thank you, Molly, and thank you, Peter Espenshade and Peter Mallary. I got you on that one. A couple of things as we're nearing kind of the home stretch, or at least the last lap. I want to apologize and make amends on the video we saw. We saw an early draft of that video that had mislabeled a person or two and was missing some key players in the recovery movement. So we're going to show the correct version of that later. Thank you for being patient with us on that. It's my pleasure now to introduce another real leader in the state's recovery movement. Fawn Montanye is the director of the Vermont Recovery Network. This is what Peter was describing earlier. It's sort of a completely innovative best practice model that we've had in Vermont for a number of years now, where we sort of get the best of both worlds. We have these local recovery centers that you've been hearing from, and then there is the Vermont Recovery Network that does such a great job in supporting those centers, in the critical role of being very nimble with data and seeing where the trends are going so we can meet things in the moment. And we've been very lucky to have Fawn Montanye as the director of the Vermont Recovery Network over the past couple of years, coming from her great work in next door New York State, running a recovery center. So Fawn, welcome.
Thank you, Peter. Thank you so much for all you've brought together tonight. No one brings a casserole when your child's an addict, or when your mom goes to rehab. Statements such as these have led countless articles on behalf of family members in recovery, those who have a loved one struggling with and/or are in recovery from a substance use disorder and/or addictive behaviors. This statement is why the support and acceptance of recovery in our communities is so vital. This is why peer-based recovery centers opened and continue today, serving those seeking recovery, those sustaining recovery, anyone in between, and everyone supporting them. My name is Fawn Montanye. I am a single mother in sustained recovery from alcohol misuse disorder since March 2016. Together, my 14-year-old daughter and 17-year-old son reside in Dorset in Bennington County. I was asked to speak tonight on the power of recovery in my work and community. I am the executive director for the Vermont Recovery Network, now located in Manchester. I am an active community volunteer, an active member of my local recovery community. Vermont Recovery Network provides the data platform, technical assistance, and a range of supports to the 12 peer-based recovery centers throughout Vermont, where we are privileged to work beside the peer professionals who are advancing access to recovery from addictions in their communities. The individuals supporting each peer-based recovery center are a small representation of the larger community throughout Vermont. The givers, the doers, the ones living their recovery openly without shame. Here we are in 2020, which may never end. Recovery today is much more than a prescriptive, abstinence-based, court-ordered mandate to comply with for a predetermined time period. Recovery today reflects all a Vermonter in 2020 is: independent, self-determined, creative, multidimensional, unique to themselves. More than anonymous 12-step fellowships, recovery today includes harm reduction and moderation mutual aid meetings, such as Harm Reduction Works. Physical activity, such as the Phoenix Recovery Center, Y12SR yoga, and an array of outdoor activities. Spiritual pathways, such as Refuge Recovery or Recovery Dharma. Family support for family and loved ones supporting those they love, whether active in addiction or in sustained recovery. And grief recovery after loss, GRASP. Everyone needs someone to connect with. The power of recovery in community is transformative. Too often, the substance is seen before the person. The person with the problem is tasked with getting help and fixing it. Let's break that down. Who has the problem? Just one or everyone in that home? Get help? How, where, when, how much? Fixing it, or meeting the expectation to never fail again and then trying to come home again. The power of recovery in community ensures that there are people to connect with and places, multiple places, that one can go to seek support. It teaches acceptance of others. It makes space for amends and redemption. Resilience and coping mechanisms are developed. It brings humility, connectivity, a heartbeat. The connection needed to help another get through a hard time is too often needed, and the celebrations are never enough. Like talking over a cup of coffee about the child trying at their recovery again. Like being able to say, I'm a person in recovery when applying for a job and being given a fair chance at a new beginning. Like hearing our pastors share news about our loved ones the way they do when calling for prayers upon those ill with any other chronic health condition. Like making a casserole and bringing it to your neighbor because you've seen so much, yet haven't said a word. The power of recovery in community are the grandparents, parents, young adults, educators, farmers, business people, living their lives today in recovery from a substance that once directed every aspect of their lives. Happy, successful in countless ways and fulfilled, living a life they have worked for and are deserving of. It is the hope that a newcomer is invigorated with when they meet someone with 36 years of recovery. It is the grace, open arms, and unconditional acceptance of anyone asking for help. Your recovery is welcome here is a sign needed on every entryway, further reinforcing the radically inclusive spirit of the recovery community. Thank you so much to Recovery Vermont for inviting us and coordinating such a meaningful event tonight. I appreciate the opportunity to lend our voice to this evening. We are the Vermont Recovery Network, and we are rooted in recovery.
Beautifully put. Thank you, Fawn. Thank you for sharing that. Really well stated. Just a health condition. And folks like Fawn and her work at the Vermont Recovery Network and the centers are really driving that home. So We're now going to go into three final things this evening. You have seen the preview of our video. You're now going to see the real thing. We're excited to share that with you. It's really a beautiful piece put together by 7 Days. We are then going to have another video of Dawn and Greg Tatro and Milne running for office. And then we're going to wrap things up and talk about next steps. So Danielle, you have the video teed up for us?
I do, and I promise this time, everyone, it is the correct one. My apologies. I had about 50 drafts of it, and I have no idea, but that one pops up. So here we go. Without further ado, this is the correct and final video.
Hello, I'm Vanessa. We're here in the lovely state of Vermont, celebrating recovery. I work down in Brattleboro at the turning point of Windham County, helping people at their most vulnerable when they're in the hospital and suffering from substance use disorder. Our recovery resources are spread throughout the entire state of Vermont, but we remain connected through the power of recovery. Recovery means to me, healing.
Recovery means to us
Freedom.
Recovery means to me rebirth.
Recovery means to us connection. Recovery means to us
Hope. Recovery means to me beauty.
Recovery means to us purpose.
Recovery means to us
A journey.
Recovery means to me being a new creation.
recovery means to us
Having fun.
recovery means to me freedom.
Recovery means to me,
Life.
recovery means to me, self-expression.
Recovery means to me health. Recovery to us means authenticity. Recovery means
To us,
freedom. Woo!
recovery means to me second chances.
Recovery is fun.
hi everybody, my name is J.R. Lane. I'm a recovery coach here in Bellows Falls, Vermont. This is one of the newest satellite offices in the state, and it's a great privilege and honor to be doing this work. I am able to help as a recovery coach people who suffer from substance use disorder attain and maintain long-term sobriety, because recovery is possible. And what we need from you as the community is your buy-in and your empathy and understanding that this is a disease, not only to fund these programs, but also to support your friends and neighbors who may also be afflicted with it. Recovery means to me hope, happiness, and freedom.
It was really beautiful. Thank you, Danielle, for showing that. And thank you, Danielle, for all this tech work behind the scenes. We're really grateful to you too. We have one final video coming up. It's really an interesting and important conversation between Scott Milne, local business person running for lieutenant governor, and Dawn and Greg Tatro, two parents who lost their daughter Jenna to this horrible disease, and who have committed so much of their time in life to work since Jenna's death on, to use their terms, on having Jenna's spirit watch over their work and guide their work to help others. And the Tatro family have just done extraordinary things throughout the state and in their hometown of Johnson. So Scott Milne wanted to send this along, and I think it's really interesting to see Scott Milne, the candidate for lieutenant governor, talk to these two folks who are real leaders in this movement, family members who've been impacted by this in such a tragic way, and how we as a state can move forward. Then we're going to come back after this video and talk about a next step or two, and then wrap things up. Danielle, are we ready to go?
Here we go.
Hey, Scott Milne here. I want to thank Peter Mallary, good Orange County name. Could talk about, from the Gertrude Mallary, Little Hoover Commission in the 50s through Dick Mallary and his great career in Vermont, and Peter Mallary, who I think came a few votes away from being Speaker of the House of Vermont. Peter, thanks for the invitation and opportunity to connect with you. Unfortunately, schedules didn't enable me to be live. Also want to do a shout out to Molly Gray. Wish you a lot of luck on November 3rd. Hopefully a little bit less luck than me. But good luck to you, and I hope we have a good last couple of weeks of the campaign. I also want to, just to David Zuckerman, I think we're going to talk about COVID and COVID's impact on mental health. The fact that it's 2 weeks from Election Day, and David Zuckerman, who's running for governor, and Scott Milne, who's running for lieutenant governor, have not been in the same space once this whole year, speaks volumes of just what we're dealing with COVID and the need to, make sure we're not killing somebody's grandmother, for lack of a better way of saying it, by being reckless with our behavior. But David, I wish you good luck too. And I will say with all sincerity, David Zuckerman is one of the best retail campaigners I have seen in my life. If you've been at a parade and caught a carrot, you've been touched by David, by the candidate Zuckerman. So I hope you all have a good time. And I'm really fortunate, as you know, Peter, you and I talked, I'm learning more than I know about the issues that we're talking about today. And I have Greg and Dawn Tatro, who have been helping me out on the Zoom call with us here. So Greg and Dawn have agreed to sort of just share some experiences and thoughts. And we're going to try to limit this to about another 8 minutes. So I'm going to let you know a couple of ideas. And Peter, thanks for the questions. I would say that we've got a lot of problems, and there's going to be a long tail on COVID, and clearly with mental health, there's going to be a lot of things we anticipate that we'll be right on, and things maybe we don't anticipate that are going to be profoundly sad for us. And I've got a blueprint, 60 ideas, Progress VT, if anybody wants to go to scottmilne.org and check it out. And there's a lot of tentacles throughout addiction, mental health in Progress VT. A couple I want to just touch on. One, expanding telemedicine. I think we want to make sure we don't lose the momentum that one of the only maybe good things about COVID is the regulations and fear of telemedicine have been unshackled, and we made massive gains there. I think whether it's people needing addiction coaching inside prisons, or just folks in rural Vermont that need help and want to be able to do it from their home, we want to make sure we keep that going. Secondly, we've proposed putting all police functions in Vermont under one agency of public safety, which I think will help make police more accountable, help integrate mental health into more traditional police functions in an effective and efficient way. Something I'd be glad to talk with any of you about on the side as well. But I wanted to, Greg and Dawn, just give you a minute to introduce yourselves. I think a lot of people know you already, but specifically, if we could talk a little bit about what you think is changed because of COVID with addiction and mental health. And then maybe if we could talk a little bit just about, some of the things that are working in Vermont with Hub and Spoke, or and some of the things that we need to improve on. I know we had a great conversation before I hit the record button. So if I can turn the microphone over to you and let you share some insights based on your personal experiences, be really appreciated.
Yeah, it's Greg Tatro from Jenna's Promise. And
Dawn Tatro.
And we are, I do believe that COVID is, a lot of the recovery centers were down because of COVID. And I think that hurt a lot of the clients. They really need that support. And, I'm pretty good friends and work a lot with Daniel Franklin. And it was pretty tough for a while because he really wanted to help these folks. And, just trying to do a Zoom with somebody who needs that much attention and support was very difficult, frustrating for Daniel. And I do believe that's one of the reasons the recovery centers and the turning points of the state. I believe that's one of the reasons our overdose rate is higher, because there was a lot of relapses because of they couldn't get to the meetings. So that just goes to show how important recovery centers are in this state. And without the recovery centers doing all the great work that they do, we'd be this world would be hurting a lot more than it is. So that's the support for those folks or the recovery centers is absolutely needed here in this state. And I hope that any of the folks on this call will make that a priority.
Thank you. And we were talking a little bit before just about the personal experiences you have of seeing people, whether they're coming out of a jail or a prison, or coming out of Valley Vista or a medical recovery center, and just perhaps some things we can do that might cost a little bit of money in the short term, but be very wise investments, both financially and just for people in the long run. Want to share some of those thoughts?
For us, we've started having people reach out to Jenna's Promise, and people were saying that they had no place to go when they were released from either jail or recovery centers like Valley Vista or Serenity House. And some of them had been gone 2 or 3 times, had been in this summer. And they just needed some kind of support. So we decided we were going to start helping pay for people to give them safe housing. And then with that housing came the support of recovery services, and also having them work with them to get a job. And it worked. People were having a safe place to live, and were had the connection of the services around, the people around that supported them. And then they received, they went out and got jobs, and they got self-worth. And so it was pretty amazing to see that if you give people the right resources and you give them that connection and that wraparound service, what the difference is.
I think that saves the state a lot of money too, Scott, because instead of people ending up back into inpatient, and some will, it's never going to be 100% success. But, if we save 50%, that's a huge savings for the state. And I think people in incarceration are the same thing. If we have a place for them to go after they serve their time, then it'll help these folks stay sober. And our cost for the state will be dramatically reduced by by having a housing outside of incarceration. And we feel that's very important. And another thing that's very important is getting some treatment while you are incarcerated, and getting the recovery centers and their coaches in there to help these folks while they're there and get them trained and ready to come out into the world, because it's pretty scary. So that would be a great thing for funding and savings for the state.
And Don, you mentioned specifically with folks that you thought the some of the existing recovery center counselors, if we could sort of break down the walls and enable it, that either through telemedicine or by being part of what's going on inside prisons, that we have the kind of the people there. We just need to deploy things a little smarter and a little wider. Is that what you were talking about? Or?
I've been working with actually 3 or 4 girls that are in incarceration right now. And they're saying there's no resources. They can't even get a 12-step book. There's no meetings. And it's pretty hopeless for them. So the girls we're talking with, they actually went into their library and photocopied a 12-step book so they could have just their own little meeting, because they needed that. You know, we have a captive audience in there, and if we can give them the tools that they need to work through this disease, then their success rate is going to be a lot better when they get out.
Tracie Hauck, I think is how you pronounce her name, from the Turning Point in Rutland, has actually been getting inside of the prisons and helping. With the COVID, she hasn't been able to, but she I think she's going to be on this call here. But she says it's working and it's saving the state a lot of money. It's hard to nail it down exactly, but we're saving money, saving lives, and hopefully making productive people. And that's the goal, really.
Mm-hmm. And any other, Don or Greg, any other? As you can tell, I'm smart enough to know when there's people smarter than me that can help me out. What I'll say to everybody on this call quickly is, we all, I think, by now have experiences with people with substance abuse disorder, substance use disorder, or and I know we're talking more about that side of things on this call, but in 2014, I was marching. I was talking with Greg and Don. I was marching in a 4th of July parade, and just based on knowing the folks that were marching in my parade, more than a third of the people either had a disorder with drugs, or had children that had a substance use disorder. So it's a profound problem in Vermont. It seems like we've got this hub and spoke system. I know, Peter, one of your questions was, how's that working? And again, I think Greg and Don, I don't want to speak for you, but it seems like it's working about as well as any government program that we see around the country. But we want to follow the facts and make sure it's continuously improving, and there's opportunities for it to be better.
Yeah, I think they do a good job with it. I know here in Lamoille County, Katie Marvin and Cheslev Group, I believe, is their name, and they do a good job with it. People are getting the medicine that they need, and you've got to remember, Suboxone's not much different than somebody who needs high blood pressure medicine or diabetes medicine. It's just a way for people to get through the addiction process, and I think it does help them a lot. It doesn't work in every case, but nothing does. But I think they've done a good job with that. And our county here, Lamoille, I think they've done a real good job. And there is other ways too, Vivitrol and other prescriptions that can help also.
Mm-hmm. Dawn, Greg, and Peter, Mallary, and everybody, thanks very much for the opportunity. This is just, I think Ms. Moulton from Washington County Mental Health is part of this forum. I don't know that we've ever met, but I just want to give you a personal plug. One of the downsides of COVID, I'm in the travel business. A lady named Pat Archambault is traditionally one of the top performing travel advisors, not only within Milne Travel, but across the American Express nationwide. She's usually in the top 25 nationwide. She's been on furlough for 5 months. I talked to her a couple of days ago. She's thought about it and wants to get into, she's applying for a job with Washington County Mental Health, I believe. And just wants to do something a little different with the rest of her life. It's a huge loss personally for me, for my business, but potentially a huge gain for Vermont. I think with COVID, there's a lot of people that are reevaluating what's most important in life, right? And obviously, this is really important. If I am elected as Lieutenant Governor, I'll look forward to being hopefully part of moving the ball forward. Greg and Don, with you and the great Jenna's Promise project you've got going on is just tremendous and something that I'm proud to know you. And it'll be fun to share and see how it evolves with you. Everybody else, again, Scott Milne, appreciate the opportunity to be with you. And we'll look forward to following up on this conversation sometime down the road, I guess, right?
That's correct. Thank you, Scott.
Thank you.
All righty. Thanks, everybody.
Great. Thank you. And our thanks to Scott Milne and to Dawn and Greg for joining us tonight. He was talking about how smart and strategic Dawn and Greg are, and you combine that with their tremendous heart and passion, and they're doing great things. So to wrap things up for tonight, we want to keep these conversations going. It's been really nice to hear from different voices and to do some listening and to connect with you all. And, just a reminder that we vote. People in recovery vote. People who access mental health services vote. And as importantly, people impacted by substance use disorder vote. People impacted by mental health conditions vote. In other words, all 630 Vermonters who are impacted by these issues, and I'm convinced we all are, vote. And it's exciting to see the commitment to learning more about best practices and to learning more about our collective commitment to innovate and bring these connections and services to Vermonters who need them most. So thank you, everybody, for joining us here tonight. We will post this on multiple channels. It's going to get thousands more views throughout the weeks. And we are really grateful to all of you for what you're doing to help move this forward. So stay in touch, and we hope to see you soon.